Good morning. Yes, can I make sure that everybody can hear me?
Yes, Dr. Tan, we can hear you loud and clear.
All right, that would be very fantastic. Yes, hi everybody. Good morning. My name is Dr. Tan. Tan Keah is my full name. Right, I'm a medical practitioner. At the same time, also adopting the concept of functional medicine in my practice. So I guess maybe many of you may not have heard of the term called functional medicine. I think in this presentation, I hope I can bring out the rather clearer concept to every one of you to understand what actually this scope of medicine is about. Okay, so let me go on. Let me start with human life cycle. I think it's a basic biology that everybody knows that we are a living thing. We are born, we grow up, we mature. After that, after we go to our peak, we will start to decline. So we will go on with this process of aging before. And this is actually inevitable for every one of us. Some of us may live longer, some of us not. Okay, there are several reasons why this happens. And in simplified forms, I classified the reason why people die, why we all die, into two different factors, being considered as external or internal reasons why we die. External reason, I think it's not difficult to understand. For example, like injury, if there's a trauma, we have a severe injury to our major organs, for example, head traumas, lungs suddenly get damaged, then of course infection comes another big to our as we are running, experiencing the very bad pandemic era right now this year. You understand how bad a small little bug can kill us, and they are very powerful. It can kill so many of us. Up to date, I think there are how many? I just heard the news, and how many millions I already lost count. People already have contracted with coronavirus infection, out of which how many have already died. This is going to increase day by day, day by day. So in short, we do not underestimate the power of the bacteria and the viruses, all these pathogens that is coexisting with human beings in this world. The third reason can be because of radiation or toxicity and any other sorts of the chemical harm to our bodily function. And as we know, we are living in the modern world, in the city, whereby we are seeing less and less natural things around us, but instead, in replacement, we are seeing more and more unnatural, human-made or synthetic substances, radiation pollutions that are getting more and more around us. So that harms our health as well. Okay, then goes to the next category. There is an internal reason why we will live shorter and we die. First thing is natural aging. When we have degeneration, degeneration means decline in function. Every part of our body will go through this wear and tear process. So hence, we will end up having a reduced organ function. We will have a reduced capability of our body organs to meet the basic needs. So eventually, when this imbalance comes to a point where there is no return, we are heading towards the end of our life. And that's another explanation of why these cancers, we are seeing more and more cancer nowadays. Cancer, it's a very big threat in your medical field. Many patients die. In fact, it is just right next to the cardiovascular cause as a death of everyone in this world. It ranks like number 2 for overall cancer mortality compared to cardiovascular. It just ranks second. Of course, there are some other pre-existing risks. I will take one example, for instance, like genetic. Some people may be born with some genetic defect or some congenital abnormalities. So certain types of these abnormalities may be very detrimental to our health. As a result, it is not expected to have a very long and healthy life. So if I combine all of these things, we can understand why we will eventually die. So since we are not going to run away from this is designed by our God, we had to face it. So what are we facing here? Overall, the life expectancy in Malaysia, not only in Malaysia, but throughout the world, across the whole globe, has significantly increased over the centuries. So taking our country as an example, in 1950, our statistics show 52.8 years is our life expectancy. Back then, like 60 years ago, 70 years ago. So after half a century, we are now in 2019, this year 2020. The life expectancy has gone up from 52.8 years until 76.1 year. That's a big jump. It's almost like 20 over years of extra life that we can enjoy. So why is this happening? And there are of course a few reasons. I will list down these four reasons. Number one, we have a better food supply. We are no longer worried about no food. There's no resources available for our next meal. No, in fact, we are having more. We are getting too much food in fact. Second reason is improved sanitation. Hygiene is very important. If you can imagine, if we are not living in a very hygienic or clean environment, we are living together with a whole lot of uncountable strains or types of bacteria and viruses. That is very harmful to our immune system. Anytime we are down with sickness, chances are we may get more complicated situation that we are facing. So improved sanitation certainly has done a very good job, good deal for us. The third reason is medical advancement. No doubt, this is definitely, it's very easy to understand. If we have a good medical support, medical facility support, doctors are around, medicines are available, chances are we can get saved. You know why we want to see doctor? Because we foresee our immune system has got some difficulty to overcome infection. That's why we need something extra. And the medical advancement is one of the crucial reason why we can live longer. And of course, the fourth reason is the government efficiency. We have a more organized government, a better organization, a better distribution of resources and the logistic. Hence, we are able to make use of this advantage that I mentioned earlier on. Otherwise, if we do not have a good government efficiency, everything that is available may not reach us. So I combine with all of these things, of course, we are seeing day by day, year by year, we are living longer and longer and longer. So isn't it a good news? Everyone can live like 100 years or 150 years. Well, things is not that simple. It's sometimes we need to look at it from a different perspective. Does longer life mean a better life? As our lifespan has already lengthened by 20 years in the past half a century, we are seeing a new forms of conditions, new diseases, or a new distribution of the disease pattern. Why is that so? And what is actually happening? Why is that we are living longer, we have a better environment, we have better health, we are facing a new forms of problems? Well, let me explain a little bit here. In the more acute illnesses like infection and injury has happened, can manage to happen because we have a longer exposure of this kind of risk. Of course, the longer we live, we are given more time for every possibility to happen, to take place. So it is easy for us to think on this logic. One more day of risk, one more day of problems we are facing. Okay, so it's not only to acute illnesses, but chronic illnesses as well. And this is the most significant part of the diseases we are facing nowadays. And one obvious reason is what? We are living long enough to expose all of these problems. So next, what will be the consequence? When we live longer and we're having more and more problems we are facing, well, we are entangled with more diseases. Okay, that's not difficult to understand, right? And as a result, we will need to have more medical treatment. Because why? With more treatments, with more illnesses, we need more and more complicated form of treatments so as to salvage our life or to treat the bad complications. Because complication can be very bad. We may have one chronic illness, but we can end up with several complications arising from just one single chronic illness. And hence, we will get a more suffering kind of days as we get older and older. This incidence, of course, happens in both acute and chronic diseases. And talking about chronic disease, some people may find themselves difficult to understand what is this thing called chronic disease. What is chronic? What is disease? The disease we know it's an illness. And chronic simply means it's a disease that lasts rather long duration. People can call it that this is the disease of the rich because you live longer, you have a you have more wealth, you can live longer, and you can buy more things. That's why you live longer. You get this kind of a privilege. But also, this is also called the disease of the aging group. You get older, you get this kind of disease. So when we get older, it doesn't mean we will go into a elderly age without any problems. Chances are it's actually the other way around. And many times we have discovered that this chronic illness is closely related to how our lifestyle is. So another term to describe chronic disease is called lifestyle disease. But after all, the more technical and more professional term to describe what chronic disease is this term called degenerative disease. Basically, it is a form of degeneration. When our body starts to decline, it can go down and down up to the point when they face big struggle, difficulty in handling the normal body function. And that is when the symptom and the signs start to emerge. And this is also the time when we diagnose the disease. The characteristic of the chronic disease is that first thing is there is no curative treatment. If there is a cure, it will not be chronic. So chronic disease up to date has got no confirmed cure. In any form of chronic disease, there is this is the answer to the up to say. We have no cure, but we have the treatment to control. If there is no cure, we don't do anything about it, things will get worse and worse. The progress is unilateral. It will just get worse. The reason is because we get older and older. Our body function will only go to less and less functional. So it is adding up with the severity of the disease. So without any active treatment, chances are we are going to lose the fight. So the endpoint is we have to take the medicine or we have to go on with the treatment until we die. That's chronic disease. So in other words, the current available therapy, the treatment, is unlikely to reverse the disease. What it can do is to mitigate or to control the worsening of the disease and aims to stabilize what has already happened to the patient. I will come up with this statement saying, pure defense with no offense, it does not win a combat. In any combat, in any sport, in any match, if a player goes to the battlefield or goes to the court playing badminton, for example, he doesn't smash, he only takes defense, he is not going to win. To win a battle, you need to have an offense. You need to take charge, you need to be in position, you need to be in the driving position. Not only looking on how to defend yourself, but you also need to go out actively to deal with the situations. So in the conventional treatment for all chronic illnesses, we are observing that something is really missing. So what is missing there? And why is it happening so? Why are we leaving a gap here? I want to explain a little bit here, okay, about the history of modern medicines. Modern medicines is the concept that we are nowadays very familiar with, which is like, when we fall sick, we go to a clinic, we go to hospital, see doctor gives us medication, giving us antibiotic. If there's an injury, we do operation. If patient has got a cancer, he may not only go for surgery, but as well chemo or radiotherapy. And these all are based on the concept of modern Western medicines. The modern Western medicine has got about a few hundred years of evolution, evolved from the very old ancient Western medical concept. But back then, 1,000 or 2,000 years ago, that concept was very unscientific and actually were not very consistent. It consistently started to become more obvious only over the past 100, 200, or 300 years when modern medicine adopted the concept of modern science. So compare modern medicine with other form of medicine. The other alternative medicine, for example, traditional Chinese medicine, Ayurvedic and others, They have a history of probably about 1,000 or 2,000 years long history. So in this world, in the medical world, we have the category or classification of medicine into two forms. Basically, we classify into these two. One is called conventional, the other one is non-conventional, or we call it alternate medicine. Alternative medicines, including many forms. There are many. I am not able to list all of them here. But conventional, there is only one, and we call it the modern Western medicine. The modern medicine, Western modern medicine is in dominance with a few reasons. But whatever it is, we are now in this position. We use modern Western medicine as our main form of treatment, and hence we are here today. There's a change in disease pattern. Disease distribution in different age group. We know they are diseases happen more on certain age group and less on the other age group. That is observed universally. Among the age group who are in the the upper end, which is like 50 years ago, 60 years and 70 years ago, we are seeing a lot of them having a chronic illness. Whereas we look on the other direction in the younger people, infection seems to be more. This is the disease distribution. And the modern medicine actually in that past 200-300 years of evolution actually didn't really have so much of exposure to diseases that happen to among those people who are old, who are elderly. Because at that time the life expectancy, remember I was saying, taking Malaysia as an example, was only 50 years. So the scientists, the doctors at that time didn't really have so many cases to observe or to study for those diseases that emerge more among the elderly above 50, 60 or 70 years old. So actually the strength of modern medicine actually is what in this slide has outlined this. The modern medicine, also known as allopathic medicine or conventional medicine, is a mainstream medicine that is very well accepted for our medical practice, scientific and evidence-based. And I mentioned just now, using drug surgery and some other forms of advanced medical devices. The strength of it is here. It's fast therapeutic effect. It works fast. So especially for symptom relief. And it is also very superior in dealing with acute illnesses. Acute illness like acute infection or injury like appendix. Yes, it is very excellent in anatomical correction, changing the structure by the means of operation. Doing the surgery can kind of like almost immediately relieve or change the cause of the disease. So I was saying appendicitis. This is a very classical example. Chances are there is no any other effective way of treatment as compared to an appendicectomy, doing an operation to remove the appendix when the appendix is having infected inflammatory state. Appendicitis can kill. So no even IV antibiotic or oral antibiotic can change this, can cure it except by doing the surgery. I mean, at least up to today, we do not see any other form of therapy more superior than doing this operation. So this is the strength of modern medicine. It works fast, it's very quick, and when coming to these structural problems, they are like the number one and there's no number two. But it also has got weaknesses. It's not just that modern medicine is perfect and has got nothing wrong, no weaknesses at all. It is not that. It is not that perfect. Modern medicine is rather disease orientated. What I mean is that many of us tend to try to establish a diagnosis when a patient comes to us. It is very much diagnosis based. We always want to have a name of the disease label on the patient's presenting complaint. Well, on one hand, it is very scientific, but sometimes too scientific can lead to rigidity. Okay, the focus is to treat based on what we have found. What diagnosis we label on the patient's illness. but it does not really focus too much on the other part of the story, which I call it self-healing. Our form of medicine, the modern medicine, really digs deep to look for the underlying cause. Instead, symptom relief is rather more focused. So that is another reason, we are not advancing. The missing point is the moment when the symptom is relieved, when patient feels happy, it is very likely that the story will not go on because patient may not return and we may have difficulty follow up the patient as a result. So partly it is also patient is also responsible to this weakness. And therefore, at the end of the day, we understand that modern medicine does not handle chronic disease very, very well. So chronic diseases, the reason of chronic disease is it's not easy to pinpoint. We have discovered that it is multifactorial. Many factors contribute together and lead to the disease. This is the outcome. And we have genetic and environmental reasons why chronic disease happens. Personal habits, lifestyle, infection exposure, injury history, and so on. It's one part of the reason. It takes very long time to develop, and once it is formed, it lasts very long time. This is a very classical characteristic of chronic illness. And the mechanism of chronic disease is that there is a failure of a body to counter the imbalance. When there is a need, but the body does not have the ability to supply, this imbalance happens. Technically, we call it the cell repair. It's not able to match the cell destruction outcome. And there is too much wear and tear. We have insufficient replacement of resources for the body to self-heal. And this is by the means of nutrients and good hormones. At the end, we are seeing this, the income and spending imbalance situation. So it not only happens to our body, it also happens to many families too. When we do not have enough income, we have a lot of spending, we will be having financial difficulties. And here comes functional medicine. Functional medicine is a scientific medical concept based on basic medical science. Basic medical science shares the same root as modern Western medicines. So basically, it's actually arising from the same scientific concept. But instead of diagnosis-orientated, functional medicine focus more on symptom-orientated, and looking for the underlying cause why this symptom happens. And we do respect the power of self-healing. Okay, there are many words here. Functional medicine thinks that every symptom means something. Our body does not, of no reason, come up with a symptom. It always has got a reason. It is just that do we understand, do we comprehend what is actually the meaning of this symptom? Functional medicine also believes in assisting the body, but not dominating the body. We help the body to do what it wants to do. We do not ask the body what to do. We provide the resources that the body needs to repair themselves. So we restore the power of self-healing, and based on the scientific human physiology and biochemistry, everything goes back to our basic science. We optimize the mainstream effect. We do not really clash. Sometimes we may explain things differently, but since we're coming from the same roots, it's actually easier for us to combine or integrate functional medicine with conventional medicine. And with this, if we are able to optimize the self-heal, self-repair process, there is actually a potential disease reversal. Well, I'm not saying there is a cure, but improvement of the disease. The dependence on medications may become less and less dependent on. Therefore, functional medicine not only can be a standalone treatment, but it can also be an adjunctive treatment, and it really does not have to contradict with the mainstream treatment. Okay, this is my last slide. I will use this to end my slide. The title of this slide says boiling water and dehydration. Just to give some imagination for every one of us here. Imagine we are very thirsty, like what I'm having now. I feel thirsty. That is when symptom happens. Okay, why is that symptom? Why do we feel thirsty? Because we lack of water. We are not hydrated well enough for the need of our body. So you go to see a doctor, the doctor examines you and have done the test and tells you, okay, this is diagnosis. Okay, you have dehydration. Not only with that, you have electrolyte loss. This is very typical when somebody has got acute gastroenteritis, AGE. When you keep purging or vomiting, you lose water, you lose electrolytes together. So what do you need to do here? You need to drink mineral water now. Doctor will tell you that you have to rehydrate yourself and then give you some order salt. And now I'm drinking water now.
Sorry, doctor, we forgot to bring your water earlier.
No worry, no worry. Perhaps these are all planned. I want to make myself thirsty to come to this slide. Right? So you need to drink water which contains mineral, which contains electrolyte. So this is mineral water drink. It's the treatment. So we have a treatment strategy established. But now, what is the available treatment? I mean, you want to have this thing done, but do you have it available in front of you? Yes, there is. There is a very hot pot of boiling mineral water in front of you, and this hot pot of water is still being boiled by the fire, by the gas. So you have the treatment, but it seems that this treatment may not be too suitable to you. What you need to do is to scoop a cup of hot water. You can't drink that boiling water, right? Can you? If you drink it, you will score the whole mouth. You cannot. You gotta add some ice cubes. Yeah, you cool down the temperature, treatment then will be very logical. Yeah, it is practical that you can start drinking the water. You drink a cup, you drink the next cup, you quench your thirst, isn't it? There is one thing here. The ice cube dilutes the electrolyte concentration. Don't you think so? We have, we have one cup of water. Okay, we don't fill up fully. We fill up like half a cup, and the rest is add up with ice and ice and ice cube and ice cube. So of course it dilutes the electrolytes. When you need to have a right concentration of electrolytes, when you are not drinking that, don't you think you need to drink more and more? But the thing is that you can only drink this much, isn't it? So at the end, we have the thirst quench, but our electrolyte replacement is not done completely. So that is in turn, it is converted into a symptom controlled. The disease is not yet cured. So later on, will we get thirsty again? Of course, we will get thirsty again. So the symptom or the illness will recur. So what do we get prepared to do for the next round when we are getting thirsty again? So this is a long-term solution thing that we need to consider, and a lot of time we are not thinking that. So do we look for more ice so that we have a quick symptom control, or we stop the fire now? Stop that fire that boils the hot pot of water for a sustainable solution. And this is really the concept of functional medicine, looking at current and looking for the future, the long-term answer. All right, so here I end my presentation.
Thank you very much, Dr. Tan. I'm going to stop sharing and I'm going to open your camera so actually people can see you. Oh, sorry. Hi, guys. Dr. Tan here. So Dr. Tan is actually our head of our medical team. The reason Dr. Tan is our head of medical team is because he believes that with wellness and with lifestyle changes, with behavior changes, with nutrition, with exercise, we can actually make a difference. So thank you so much, Dr. Tan.